Uh, mbola vinaka everyone vinakavakilevu na sema mai na ndona vitala noa en singa vinaka ni kosa vi machungona vitu en mbongi singa lotulevu mai viti vambuli tukai ni vikemni na vivakani na nanda na mai vitalo tiko bateki asinate senirewa tiko da Daugunu sema sarchuku moko mai ndriketi may vanua levo nandoana vetalanoa membaleta tiko na ulutaga ni tiko mbulambula ulutaga ni tiko mbulambula vatakena karua ngande tiko may viti ndoana marama okla ni bunga baka vikimnio ni sando sarava chukumbeka na nona video mona livalip o Dr. Barbara O'Neill okla na maramongo kilele usar chuku na mbuturara ni veka baleta na nonda mbula mbula vakayango vakatalangakina na nona vivaka na numiti kokoya nononda reida na veka enda kania kena veka enda ngunuva undu vamure toka sona nona video mona liva liva kena vimatangali mate rao talanga ninda rao ni tarova na kena tete ke vaka minda vakamurianga sonaka sungsut minda laku i valimbula ndini ni mara mabuni wai sando vakamadal takamoko sonaka sambo matata venaka saranga ia da mara ni samba chukumengo asinate Daugunu ngai vakamadal kinoko sig venaka ni kuambaleta ni na bulon Disemba se na madanga katumai sana tanto tiko mikine na nonda vanoi viti na marama vuni wengo Dr. Barbara O'Neill ia me vakavi kemni na nungui tokani ni do vakamure tiko mai na nungui bata ni sember ni tiko vuna nonda vitala noa tana warakira madana kena vomer na sema mai na ronga tamande dona sere ronga tamande dona sere mendana vakaronga toka mendana ke warakira na kena vo mer na sema mai sig venaka ni ko vakamultika ni vikemni ken vinaka vakalevu na nomuni sole na nomuni ngone menda mai vimbulongo ditu sig venaka ni ko vausi vina ulutaga ni tiko mbulumbula ngondo ndina na ulutaga bimbi ni tarikenda kede tiko na lewe viti na bimbi ni nonda rede tiko na nonda mbula na vekanda kania na vekanda ngunuva balatea baka bimbi tek sarangakina na nonda bula meda kako ni da tu mate se ke baka da tu mate ngoni sala da mande ndara ni da muria mera ni da na bulum-bulum bina katena kene ya me baka ni maramati ko ni telem maramana ita na maramongo endara ngande mande telem na non to sere na sere do kiliten tu kina na non to sana mai televu na sere ngona pusta telem meda na rongoda manda na sere ngome vakatang-tang manda yani meda na rongoda manda ni mber ni dana ngai teka buyan ni dana rongoda ni talano mebe maramana ita Asinate Senirewa Daugunu ni mbula bina
Vive que na vei por tu jaua e comida na ni una
Kewarai na saga metong balangando. Pam dibinakan na ser totokoya, ser membeletir tono kanta to mena sana waktu orang hotel lewu, wakam boleh tukan ibi kem ni kesara, na sini binakan ni kuah, wakam boleh tukan ibi apisai mutu nan bitu ni bola binaka, dari sia ngone raba, ser na musu medi lalobaki, bola binaka Kristen Jeremiah asinate varo ke onro masih besi dom bule binaka na bakarong ti kumai en ya kai binaka ni sini ko inda bakam bul sarango be asinate maramanita asinate bakam bul matamai be ira na we kandara barong ti kumai ni ko
Bulu binaka. Binaka
ni
level Dr. Tarisi.
binaka iya kera mantanga ni oba madal tekem ni manta nomoni koro korni vasu kena bono ni susuki na sinate
Vinaka, au maramani Lomanasau, Toka Toka Te level, the second oldest daughter of Ratu Store Tikoda, and Dr. Andilo Fitumalani, au Vasui Nambukandra na Korotumura.
Andina.
Usunga
Binaka.
mai ia,
Andina.
pas.
Num cornivas, eh? Bully Madibe, num cornivul from primary school all the way up. Where did you go to school?
Okay, so I went to Gospel Primary, and then kindergarten at Gospel, and then I started at. I went to Auntie That Kumbau School from Form 2 to Form 4, and then I joined the Seventh-day Adventist High School in New Zealand from Form 5 to Form 6, and then on to university studies.
Okay. What did you study at the university?
I did my degree in accounting and management,
Mhm.
and went further to do my master's
Okay.
in my MBA.
Oh, okay. And which country did you stay mostly in? New Zealand, Australia, or where?
New Zealand, actually. I've
Okay.
been there for over 25 years, over 25-ish years, yeah.
Okay. And where did you study?
I
Which
studied
university?
at Auckland University of Technology, previously known as AUT,
Mm-hmm.
and that's where I got my master's. But I went and did my master's after working as an accountant for about 12 years. Yeah.
Okay. And now you have moved back permanently to Fiji?
I have. I have. Best decision ever. We moved back to Fiji after COVID. Just during COVID, we saw
Mhm.
that it was necessary, to sustain us during this period. Everything was a little bit vulnerable at that time, the loss of jobs and so on. So after taking everything into consideration, it was just the right move to come back home.
And how have you been finding life like now, after 25 years in New Zealand? That's a long time. That's a quarter of a century.
Yes, yes. It was a challenge initially, but
Mm.
we actually work as missionaries. So we've come back to do
Mm.
God's work full time in the area of health.
Right.
And so, because we had that purpose in mind,
Mm.
the transition wasn't too difficult.
Mm-hmm.
If you know what I mean, it
Right.
was very intentional.
Right.
It was a struggle initially, but you are Fijian at
Yes.
heart, and so that it just continues from there. And so yeah, it had its challenges, but we were definitely not looking back. It's the best decision we've made.
Vinaka Bakalevo. Yeah, thank you so much for setting the scene for us today and for our listeners, particularly when we're talking about, life habits, in terms of healthy living. Um, and I think, before we went on the live session, we were talking about the benefits of, living off the land and living a simple life and going back to what life was like. Maybe even there was some discussions of, going back to the Garden of Eden, where everything started. So maybe, linking it to that kind of discussion and the idea of living off the land and, thinking about our own lifestyle. What would you like to say about that, about the importance of, looking after our precious gift? From our Father Almighty, which is our life.
Absolutely. Okay, well, I'll just give you a bit of background,
Yeah.
possibly that to give you some context on as to why we've made this decision. During COVID, I was working for the Salvation Army in New Zealand, and uh, as you know, overseas, it, when you hold such position, it can be quite taxing and demanding.
Mm.
And so, you're working long hours, and I prior to coming back to Fiji, I lost my mother to cancer, and I lost my sister to cancer as well. And
Mm.
so, if this doesn't wake anyone up, there's for me personally, it was a wake up call because we were a very close knit family. It was just my
Mm.
mother, my and my sister, and now the two of them have, their lives have been taken, and they've, because of disease.
Mm.
It was a reawakening for me. It made me think, then, if I am left behind, there must be a purpose for me, and there
Mm.
must be a purpose that God wants me
Mm.
um, to be alive, and so I did a lot of soul searching, and um, that was around the same time I had married my husband. My husband is 27 years older than me, and he had diabetes. He had prostate cancer as well, and all of this, and having experienced the loss, it was hey, you can't just sit on this. You need to wake up. And so I was also seeing myself in my journey, and I could see that I was bound to follow through the same way because I was living the same lifestyle. I was, there was, in our upbringing, there's so much expectations that we take on with us. And then we've got to be this, we've got to be that. And, and so I realized, look, if I continue this way, I'm bound to get the same diseases because as one of the things Barbara talks about is genetics loads the gun, lifestyle pulls the trigger. Okay, so because my mom and sister had died from cancer, I was predisposed to this disease. And so if I continued on, and I inherited the same habits, the same lifestyle, and that's what we actually inherit. And so I knew that I was going to go down the same path. So with all this happening in the background, and with COVID setting in, and with a husband that was going through his own health challenges, we were forced to, hey, you got to leave an example. You've got to apply this to yourself. The example must start from home first. And before we can, everything that we're learning, we've got to apply it. And the same as, we can relate to the Bible as well. And so, as we worked on my husband, as I worked on my husband, he was 120 kgs. Net, very sickly, had prostate cancer, was just going through the whole process, and diabetes. And so we changed our lifestyle. We implemented exercise, we implemented a plant-based diet, more organic diet, exercise. We made sure we were drinking water, sufficiently according to our weight and so on. And we implemented New Start. As you know, I mean, you've had one of the doctors in your show before. Eminoni. Yeah, Dr. Dakua, who talked about New Start, and this is as simple as, because it doesn't cost anything. It actually just requires discipline. And a change of mindset, obviously. So we applied that, and within 6 months, we applied that on my husband. Within 6 months, he had lost weight. He had come right down to about in his 80s. He looked really healthy. He was exercising, and we're going to the gym, and some of these things, for a 70, well, at that time he was 69. These things are not normal for us at that age. And so, my husband needed to take responsibility of, we were a young couple, so to speak. We were just gotten married, and we wanted to enjoy our lives together. So we were both aware that we needed to take responsibility of our own lives.
Wow.
And that's the journey. And he no longer has prostate cancer. And cutting the story short, he no longer has prostate cancer, and he does not have diabetes anymore.
Wow.
And this took a couple of months, and one of the most important thing in this journey is maintaining that balance and knowing your blood markers. Okay, so for us, sometimes it's we demonize the doctors, and that they don't help, and then we've got to remember that they're there for a reason. And we're trying to, most of the time, solve a chronic issue, which is a lifestyle issue, by implementing the emergency solutions that the doctor is truly there for. And so what we did was we did his markers. We saw what his blood markers were, his kidney filtration rate, his heart. He had a history. His family was predisposed to heart conditions.
Wow.
And so we had to look at that history. We got to make sure that his heart was okay, his kidney function was okay, his cholesterol, because he was 120, diabetes he had diabetes, full-blown diabetes.
Wow.
He had peripheral neuropathy issues, so all these things were, full-blown with him. So the good thing with New Zealand is that we have this app. It's called, the health app, where whatever information that's kept and all the results, the tests done by the doctors, we have access to it on our phones. So we can see how we're trending in terms of our health. And so from experience, usually after 2 to 3 months, that's when you can actually see some change in your blood work. And so after 2-3 months, we would go back and do another blood work and then compare to see how we're trending, how we're going. Is his kidney improving or not? And then we just continued on and continued to do the things that the body was responding to. What I mean by that is our bodies all differ. So there's no you can apply a certain you can follow through with a program, but in some areas your bodies may respond well in certain foods and so on. So this is all dependent on your makeup, your history, whether you've been dependent on medication and so on. And that's one of the most that's very important to take into account, because most people pull their pills out immediately when they change. No, your body's been depending on these pills for a while. And so you've got to work with your doctor to say, look, they will then say, look, I've got to take those pills, you're doing really well. And so it's working alongside your doctors in terms of your blood work. And I understand that the doctors have a different system that they promote, and this is why it's so important to be educated on how to make good decisions, because we'll get different people coming and saying, hey, you gotta do this, you gotta do that, but you've got to sit down and you've got to make the right decision for yourself. And so if we do not educate, we won't be able to make the right choices, because at the end of the day, you are responsible for your life.
Now,
and when you take sorry.
yes. Now the point about, like comparing how the medical system is like in New Zealand. Now that you're in Fiji, how are you seeing, for in terms of the blood works? Because in New Zealand, they call you, right? They email you, they follow you, they try and find out where you are. But now you're in Reketi. How has the change happened for both of you?
Very good question. Very good question. So this is I guess it's most relevant when we're taking care of others that are not well. And so, because you have these two groups of people where, a lot of people in Fiji, to be quite honest, and we're talking about not only the village setting, we're talking about in Lambasa town, Savasavu, to be
So we'll just wait for Asinate to reconnect. Sorry, Sinate, I think your audio was dragging a little bit there. Can you hear me? Iya, ni bola binaka na pararong tiko mai, kero bitano chungo ke Asinate tiko randa ngunu, siamo tiko mai koe mai ndreketi, mai ah, Raketi madwata, wala ka na koro ng babatu, na otino sabi na daw ngunu, ero ando ba tiko tu iliw may nistilandi, yung goro sa kaulo tiko may vanolivo. Kani maraw ni siyama tiko mo o sinati na sigbilang ni kuwa, ni varong tarchumbek nga na turang otino sabi na daw ngunu, nabital no tiko nga ni bimbi ni tiko bulang-bulay, nanonta ready tiko nonton bula na bebaka pamadalta katsuka sinate na nonta kilikeda pakatikeda na membaleta na nonton ra na nonta uto na nonta ivi na vika membaleta na nonta history beka nimbula ni bubale baka sorong tanto ngole ibal nimbula do tarmo bunuai se onasi ento num do bubale tumbunonan ra ento beka tobi matini uto ento beka tobi cancer se nangangun sa tabaka yuki na sa kanto toring mai cancer taban beka cancer nin ra se cancer ni katiningone se prostate cancer cancer taban nga ento ba vale na fomo o claro, indo na ulutang ang bimbisar nga was etuk mingo o asinati ng bimbi ni nonta klikenda pakatekeda. Nawambul kan vikem vikeve na vivekani danawara kasi natin may nasema talamay mulumulumba ka balilay na sema ni Mona Liba may madwata na sigmina ni ko wambul tiko vikem viketsar alisi buki-buki mbule binaka asinati mo de bakava ako tuitumbo ke nauba kini si mere makandre dombula binaka vale buna nomni sema tiku mena sig binani kuwa nanonta sema sar chugen reketi modwata nanonta marama bulangi o asinati ndongunu rondo tuilu may Islandi and nandono balausar karo sa wagatik gomen rakete matuwate na nonro kaulo tiko iya na nonro ngolevo tiko na nonro bikavivi ni dokoloto ro sa garit kino ro na bimbi ni nonro mero bulan-bulan pinake bisa una kenro kakana ro tiko bumero pako koyango lebu na non ro ngunuwai ro wuli da talaga na be ka membeleta na non ro bula wasa chuk mia o sinati na non ro re talaga na non ro nra sena blood type matanga lebu na kau me wuli da na vital no ni kwa goso na kada ro ninda wuli kerekin dari di buli kerekina na bimbi ni non da rede na non da bula vakayan tua. Maro taka na nomuli siama tiko mai, ke baka tiko so na nomuli taro, ninga siama talanga mai na vital no ni kua, ia o ba bini binaka na no na siama talanga mini kua sinate, ya baku muri tiko ka na nero a vital no tiko ke bunuai e minoni da kua. Tolo binatau, o klani bunuai tiko o bunuai da kua mai American Samoa. Tiko mo ko may pango-pango. Kaya kasi ama tiko mo ko si Ronin Dobi kam ni o ni tukuno wa ni rakati ko na vital no me baleta tiko mulpula kasi ama sar chika na vital no ni ko bat kasi nati. Nangona vital tarmiki no sinati na vital no me baleta na no na na tiko mayo bunuai Barbara O'Neill na mara katumay mani wasetu mikino sinate na bimbi ni nonta biositaka na vika membeleta na Tiko Bulabula. Kama ni nanumalis tal kinoko na vitala noa wate ke wunuai e minoni ndakua. E na nona waseti kumayo wunuai minoni na bimbi ni kakana ndakania. Dotal ngaya kati ko wunuai minoni na ngona ni muathe. Le weekend be umatanga aundo tolu baka mamanda na ngona ni muathe. Sa gendo na may talo no wunuai e minoni le baka bimbi takati ko na bimbi ni ngau na momoa de kena. Meron ni bulong-bulong kena na yan, meron ni nakaba na nona itabi. Ya, so nakau bulida, buwan na turangan ko, bunuay emino ni takua, da babi di vinaka. Na nona may bakitabi bat kiyawin na vida na bula sa wati. Ya, kanimaraw ni sa siya matalamin ko sinati, mena raw ni may tomalatal na nona bitala no, na nero sa bitala takati ko baka taba ng bula ni tiko menisilandi, wat kena non rosalis talang go iviti. La taba so naka vinaka rowli da non rosati ko buling ko mendaketi may matwat. Dana siya matalang go biasinati, men tomalatale na nero bitalo. Kiso bikim ni o ni beo siya may so na ulutanga, siya na bikaw nila kudurumati ko membaleta na tiko bulong-bula, nimbito may. Nimbita lang nga may nanom ni bakasama nunggoy bata-bata. Okay, boleh na kasi natin you back again?
Yes, sorry about
Yeah,
that.
so I think the internet just dropped.
Yes.
Yeah. So we'll go back to the question I asked in terms of, your life back in New Zealand and now coming back to Fiji and knowing, the medical system is totally very different between the two countries. How are you adapting to the new way of life now that you are having in Reketi Matwata?
Okay. Thank you so much. I guess one of the things that we do here is we also educate and help those that are around us. We run a charity, first of all, called Shalom Wellness. And that charity, what we do is we help the community, empower them, help them understand what questions to ask when they go to the doctors, what are their rights, and so on. So in terms of the question that you asked, in New Zealand, having that app and having all the information, so it's quite transparent. The doctors, when they do their test, we have access to all that test in our mobile. And here in Fiji, we do not have that. So I find that when we're working with our clients, health clients here in Fiji, most of them have no idea why they're taking their pills. They said, oh, we were just given these pills. We don't know why we're taking them. And some do have an idea, but they don't understand as to what is that pill going to do to your body. And there's a huge disparity between, the doctors and the patients. I'm not saying this in a bad way, but we're quite open in New Zealand. We feel like we can get a family member to come with us and support us, and they accept and they promote that whānau support that you have in New Zealand. In Fiji, when I this is an example, when I go with my health clients, I'm always asked, so who are you? How are you related? And I understand those are privacy issues and those are important as well. But that kind of hinders when you're asking questions, we don't have this openness, this welcoming openness to ask questions. So I see I don't know whether this is coming from our cultural background where there's you listen, you're the patient, you listen, and he knows better, he's the doctor. And he's qualified, but no, that there's an imbalance there that the patients need to know. They need to be empowered, or they need to understand what's going on in their bodies. So in that, in terms of what you asked, there is a huge gap between the knowledge, the understanding to empower them to know and understand what's happening in their bodies, so they can make the right choices when they go back home, they become more aware. Thank you.
Do you understand, right? Thank you for providing that kind of background as well, for our listeners, to appreciate again the use of technology, yeah? In which every information about you, that is yours, is easily accessible. With the use of your phone, you can be able to track it. And I really like what you said there, in which after a couple of months you can go back and get your blood works, and then you can compare what was my blood situation 3 months ago, and now looking at what the result is now. What can I learn from 3 months ago to what is happening now? So in terms of the local communities, do you feel that they have the what's the word, the confidence to be able to go to the doctors if they feel unwell?
No, actually, we have this very um, a negative view that like
Mm,
some are really afraid to go to the doctors
right.
because of the lack of information.
Yes.
We have situations where they go to the doctors
Mm,
and because I understand the doctors are so busy.
mm,
They are so under-resourced. And I'm not here to demonize the doctors,
mm,
I just want to put it out there. But most of our people, um, they go to the doctors and they're like, okay, okay, the doctor has said this. He knows everything that is good for me. Um, and somehow there's that gap of, information that they need to know and the risks related to
mm,
what's going to in treatment that they're going to get. And so when they go ahead, and I hear stories about people saying,
mm,
I never wanted to get my leg cut, amputated. I didn't know that there were other options. And and that's impacting on the villagers. And they've gone to the
mm,
other extreme where they don't go to the doctors at all.
mm,
And they are just immersed in the natural um,
mm,
substances, what's all around us, and that's not bad. But in one of my researches, I Dr. Jeffrey, he's a biologist from New Zealand, from America, said um, there's two toolbox, so to speak, right?
mm,
There's one toolbox has your traditional, conventional, doctors, pharmaceuticals, and all that. And the other toolbox is the herbs, the herbology, and those natural holistic treatment. Okay, and he's saying two different toolbox, same aggressive approach.
mhm,
Okay, so this is what we see our indigenous people going to the other extreme
mm,
because lack of knowledge. Um, they go ahead and they use our natural remedies, but they overdo it.
mm,
When you have a kidney problem, that's already when your kidneys are malfunctioning because of diabetes.
mm,
um, those are the complications of diabetes. You can get chronic kidney disease and so on.
mm,
And so when you have an impaired kidney, you you use these herbs, you can actually abuse your organs. You can actually
mm.
harm them.
It makes it
And
worse. Mm,
yeah,
mm,
and so you need to be very cautious because herbs are
mm,
very effective. But it's like you're putting a new engine, or you're applying something that's very effective to a rundown machine.
mm,
Yeah.
mm,
And so this is where the laws of temperance comes in. It's using wisely the things that are good for us.
mm,
Uh, Getting rid of the bad things, but using wisely the things that are good for us. And this is how things are trending now. And so what we try and do, I mean, we're not a charity, but we know that as you work with one village at a time, one
mm,
home at a time, you empower people and they start to ask questions, you know,
mm,
and they are starting to ask questions. They're wanting, I said, you need to have a file. You need to have your results. When a doctor says, you ask him, can I have those results so I can have it with me so that when I seek out other avenues of help, I have this information to help the next person that may want to assist me in my health journey. And I just have to say one thing, Zen's Medical. Now, I'm finding them very open and very supportive to our communities here
That's the
in
one in
Fiji, in Vanuatu.
Lautoka? Or do they have a branch
They're
in Honolulu?
Yes, they're in Mombasa. And the good thing is that the government is now
Mm.
paying and subsidizing full subsidy, I believe. Oh, well, for certain blood tests,
Yeah.
most of the essential ones, the government takes care of
Okay.
those costs, medical costs for those that are on social
Mm.
welfare. And that's a really good start.
Mm.
And we're very happy with that because as we get their tests and I sit with them when they're with the doctors, because they're not confident.
Mm.
Um, as you know their file, you've talked with them, you've gone on that journey with them. So you ask them, is it okay if I talk to the doctor on your behalf?
Mm-hmm.
And that they say yes. And so the doctor is in front of you when you're
Mm.
communicating with them so that there's no issues with privacy and so
Yeah.
on. They give they say, yeah, I'm okay. She's here to help me. She's my support person.
Mm.
And the doctors, as particularly in Lambasa and Sawasawa, they're very open to sharing that information. What
Mm.
I do with that information, I come back to the family.
Mm.
I sit down with the family,
Mm.
because often when they're unwell and with the lack of not so much lack of education, because we try and simplify it for them, but we want the family who's now
Mm.
supporting the sick person to also be aware.
Mm.
Um, so so we sit with the family and educate the family. This is what's happening because of this, because of the diabetes. He's starting to feel pains, and
Mm.
there's no feeling on the bottom of the feet. What is that called? That's called peripheral neuropathy, when
Mm.
your nerve endings die because of the high blood sugar and so on. And and that's how we work with them. And it takes a while to
Yeah.
gain people's trust. I tell you, when you gain their trust, normally I take people with me to the doctors,
Mm.
and they say, "Oh, my doctor has come
Yeah.
with me," and I'm like, "Oh, I
Yeah.
never said that. I was,
Mm.
but that they're so happy, they
Mm.
feel that they cared for,
Mm.
that somebody cares for, wants the best for their well-being."
Yeah. The other question I have, because we have our Fijian community, in the rural areas. What would be the issue of language? Because a lot of our medical doctors may be Fiji Indian or Chinese, or and also many of our medical terms are in English. How does it work in terms of translating it to the local dialect?
As you can see, my my Fijian is not so good. But in terms of the doctors, these Indian doctors, they especially in Vanua level,
Yeah.
they speak Fijian.
Okay.
But yeah, so the doctors in that sense,
Mm.
they can speak enough Fijian to simplify and to speak to
Mm.
them direct, even the Indian doctors,
In the
and that's
dialect?
really
Can they speak in
wonderful.
the Motherwater dialect as well?
No, but
Some
that's where
do.
my husband comes in.
Okay.
Um, the some actually do, yes, but
Mm.
they try uh not so much in the dialect. This is in
Okay.
Bowen,
Mm.
but no, there's been one or two that speak
Mm.
the dialect.
Mm.
My husband, in that sense, my husband comes with me.
Okay.
Or what I normally do is I always get their family member to come
Member.
with me.
Mm.
Uh, because normally they will say, I said, no, I'm a support person, but I'm not
Mm.
a family member. So I always bring a family member in order to kind of step in when the doctors try and go, I can't share this with you.
Yeah.
And so I have a family member that comes with them as well, that knows how to speak in English, understand, or even
And then
translate what
translate.
I'm saying as
Yes.
well. And then the family member shares that in their dialect so that there's no miscommunication or
Miscommunication,
drop
yes.
off, because that seems to be very vital in
Yes.
education and
Yes.
through
Because
this whole
information
process.
is power, right? And it's really important because there's life and death, right? For that particular patient.
I mean, this is one of the negative things. Just to touch on that very quickly, is
Mm.
that I had an incident. I went to the emergency, and the doctors had mentioned that, look, we can't release the information. And I said, look,
Mm.
I'm not a family member, but I'm going to take this person home.
Mm.
I need to understand the treatment you've given this person. I
Mm.
know this, but we'd like to see the results.
Mm.
And in New Zealand, we have what is called the Official Information Act,
Mm-hmm.
which means we have the right.
Mm.
It's our information, and we have the right to ask for that
Mm.
information. And the third parties are just holding the information
Mm.
for us.
But then the
Uh,
irony of it too, you can only ask a question if you know, right? So if you don't know the information, how can you ask the right question?
Absolutely correct.
Mm.
And that's where I try and work with the doctors
Mm.
and get the information, sit down with the family with the approval of I normally get the patient to talk to the doctors while I'm there, and they say,
Mm.
look, yes, you can release information to her. So I take that information, put in their file, go to their family and say, this is the treatment that has just happened in the
Mm.
hospital because this is what,
Mm.
and this is how we ought to move on. These are the pills that they've given. These are the side effects of those pills. This is how but this is the reason why they've given these pills.
Mm. So giving the kind of the background information, I think it's really important. Now I want to go back to Mr. Daugunu, your husband. Given that case study you've just shared, given his background, and now he's lost that weight. There's no more diabetes and there's no more prostate cancer. What were some of the things, maybe just three things, if you could highlight, that he did to make that happen? Because that's really something that some of our listeners would be really interested to do. Because diabetes is really rife in Fiji, hands down, everybody knows that. And again, among our men, prostate cancer is something that is really, really, affecting many, many families, including my family with my late father. He passed away when he was 87. He lived a long life, but unfortunately he had, prostate cancer towards the end of his life. Would you like just to kind of encourage our men who are listening? Because I could see a lot of men are listening right here online. What
Awesome.
would be
Thank
something just to kind of, encourage them? And of course, Mr. Dongunu is a wonderful example for that.
you. Okay. So one of the biggest thing with diabetes is understanding that it is due to insulin resistance. Okay. And I think many would have heard by now that in FB and TikTok, what you call intermittent fasting.
Mm-hmm.
Okay. And that's fasting so that your body can utilize the excess, so the more you eat and how often you eat, the body produces insulin.
Mm-hmm.
So, Okenda and Dokana, we eat in the morning and we continuously eat right throughout the day.
Mm-hmm.
And so the body needs a rest. And so one of the most important thing for him was making sure that he ate at the right time and didn't eat in between meals. Because the more often you eat, the body, the body produces insulin.
So what would be the best time for him to have his breakfast?
Breakfast? Well, everyone differs, but at 10 o'clock, I started my husband at 10 o'clock, but he preferred 7 o'clock.
Okay.
And then he ate his second meal in the afternoon at 3 o'clock.
Okay.
Because when he's sleeping, there's no more digestion taking place and the body is resting.
Okay.
And eating at the right time and teaching this. So what we're doing here with teaching the body, because it's been eating anyhow, like it's been doing whatever it likes.
Yes.
And so now it's bringing back the body into this discipline. So eating twice a day was very important because the more you eat, the more insulin that's produced, and the body is resisting the insulin. That's why the diabetes, the diabetes is the result of the body resisting the insulin. So you don't want the body to produce too much insulin. So intermittent fasting works really well. The second thing was exercise. Exercise is very vital because exercise actually lowers your my husband is trying to remind me. Okay, thank you, Han. So exercise is very vital because it brings your blood sugar down. And we're also trying to combat here the complications that is caused by diabetes, which is you get your heart conditions, your heart issues, and so on, and your kidney issues. So exercise is so vital. We found that
is there a particular type of exercise that works for him the most?
Yes, I think at his age.
Yeah.
And we have to be cautious because of other things that's happening in the body that we were aware of. Walking. And then you because my husband wasn't used to exercise, so you have to start slowly. Some people can just hit the gym and go for gold, but it depends on who you're working with. So with my husband, I had to make it enjoyable for him, first of all, and walking was because he was large. It didn't put too much pressure on his feet, and so on. So ease into the exercise that they feel most comfortable. Some would prefer swimming because less pressure on the body.
And for walking, is there a particular time that he does his walk?
Early in the morning when the air is fresh and there's all the pollution of all the cars, breathing fresh air, best when the sun is just beaming, starting to come out. That's your vitamin D, and that's really great for those who are diabetic, often that they're lacking vitamin D. So you're getting fresh air all at once. Exercise, you're getting oxygen into your body, which is great. We've got the first beam, the light of the sun, which is great. And if you're walking bare feet and you're earthing, that's really good, especially if you're using computers all the time. And so all this, you can get all these from external or outdoor exercise, which is ideal, rather than indoors.
And for swimming, how often does he like to go to the sea or the river, or does he have a swimming pool?
Well, here we have the river, which is beautiful.
Yes.
But in New Zealand, when we were working on him, we used the pools, the public pools.
Yes.
But we also use the sauna. The sauna, all of this to make him sweat.
Yes.
That's really good as well, getting out the toxins. And that's what we did in New Zealand. Here we just use
Nice.
the river. We
Beautiful.
out in the sun, the good sunlight, which is free. We do gardening in the whole process as well, because you're earthing at the same time. And the other thing as well to note was the simple thing of water.
Yes.
Water,
So
water.
important, yeah?
It is so important that it's just something that's so a natural remedy that's really underestimated.
Yes.
And it's like, how can you wake up? I mean, you wake up, you have a machine. The water it's got to start your body. You've got to start. Some of us just go straight to eating a meal before drinking water. And water is essential, and exercise to get that machine in operation. And so that's probably the
Yes.
main three things.
Wow.
And very simple, doesn't cost a lot of money.
I think that's some really good points and very practical as well. Thanking both of you, and Mr. Daugunu for sharing his story, especially for our listeners and for our men. Because when it comes to men's health, most of the time, we talk about women's health. We tend to, for me personally, I've seen there's a lot of discussions, and a lot of attention given to us women. And I think for us women, generally, we love to talk about health. But our men, they tend to kind of like shut the topic down and talk about other things. So, vinakabakalebo to Mr. Daugunu with na that is listening. Vinakabalib sa turang weka. May nanumunitalan no ha. Meron ni Rabulikin o iran na wekan. Ito okay. O iran na turang. Lilim sarangan ko rabarong chukumay. And sinubi na kanikwa. Iya.
I
Sinati,
just
you
want
wanna...
to touch
Yes,
one more point.
sure.
Sorry, Dr. Kapsi. This is the vital and the binding factor that brings all of this together is the mind. Okay. We are having to change the mindset of our loved ones. And this is, you have a mindset, a 20-year mindset, that you're trying addictions to food,
Yes.
addictions to a certain way of life.
Mm.
And so that is where God comes in. That is where God comes in, because we are so stuck there's so much emotions that are also involved in the way we live our lives. And these are often very negative emotions. And this, we see it in the health of our ladies, and also with our men.
Yes.
And their interactions at home. And the disease manifests itself from all this emotional trauma that we go through it as a couple, as a family, and so on. And one of the biggest thing with my clients that come, and they come on site, sometimes they come and stay here. After a couple of days, when they gain your trust, then the truth starts to come out. And it seems to be, and often it's to do with some trauma that they've experienced. And that is the biggest thing that God is wanting to get hold of. And this is where my husband comes in our help with the patients, with the clients. My husband comes in and shares from the Word of God to show them that God has already promised that He will heal us, but we need to do our part. And he shares from the Word of God, and like in 2 Timothy 1:7, God has not given us a spirit of fear, but of love and of power and of a sound mind. And sometimes when we are told we are diseased, or we have a disease, a diagnosis, fear comes in, and we're so desperate. We move around like headless chooks. We look around for solutions, and we don't take the time just to stop and take it to God, because He will direct our path. And He will change our mindset. He will take us to His to the natural things that he has provided for us to heal us. And I just wanted to touch on that, because you may be eating well, but if the mind is unhealthy, it will not work, because this is where all the instructions comes to the rest of the body. And then Christ must be in here for healing to come. Thank you.
Maybe before we'll finish our talano, I'll come back to your non-profit organization, just so people can be able to reach out to you both, particularly those who are in Vanuatu as well. Now, let's talk about Dr. Barbara O'Neill, and I know many of our listeners are familiar with her, particularly her presence on social media and online. Tell us about her coming over to Fiji, and how this program that you're organizing came to be. Now that it's scheduled to next week, Senate.
Yes. So, well, I think it's 2 weeks' time. So, Barbara will be coming in on the 8th, sorry, 7th, but her first session starts on the 8th of December.
Okay.
That will be in Nandi, 6 to 9 p.m. at the Nandi International School. That's in the back road. And and the next session will be on the 9th, 8th and the 9th in Suva at the Civic Upper Auditorium from 6 to 9 p.m. and the 10th as well. So it's 2 days in Suva and the 10th at the Civic Auditorium, Upper Auditorium as well. So these 2 days she'll be talking on different topics. So one is not a repetition of the other. The next one is not a repetition of the other. So people can choose to go to both. And we have the third one. We're so blessed. The fourth session is in Lambasa. So we're so blessed that she's coming all the way to Vanua level. It'll be at the Ramada Hotel at the Damoda City in Lambasa. So she'll be talking on health there as well, and particularly on diabetes, high blood pressure, obesity, and what she actually focuses on is the education on how the body works.
Okay. Wow,
This is really
that's
important.
amazing. Yes.
Yeah, this is really important because, whether you go to a doctor or you go to anyone from any walks of life, whether it's a naturopath or you will have to digest those problems. You have to know your organs. So what she does is she teaches you how to provide the right environment for the body to heal itself, because we believe that God created this body, right? So we must be empowered we must know how the body works. And often this is given to the doctors, and it's no, the doctors know. No, we have a duty to know. And so that's what she does. She teaches us how to understand the body, the symptoms and what it's doing, and how to bring the body back to balance by taking a holistic and natural approach to heal the body naturally. And that's what she's she just empowers us. She's an educator.
Okay. And you've mentioned that she's been to Fiji before. What's the difference between her previous time in Fiji than the one coming up?
Okay, so we the ministry Reflecting Christ, that is a ministry that is administered or organized by Mr. and Mrs. Taukave, and they are located in Nandi. They normally have a youth camp or young people, and they focus this on young people. They normally bring Barbara in to educate the young on how to become.
Okay, I think we've lost you back again, Sinate? Are you there?
Yes, I'm back again. Sorry, I don't know what happened.
Yeah.
Yeah, so that's what the ministry was doing at a smaller scale. Now, since after COVID, Barbara's become a well-known influencer on YouTube, on TikTok or YouTube. And so, this is the difference. We're opening it up because we've become quite aware as well. I think in November last year, there was an article that was written by the wellness clinic.
Yeah.
And talking about diabetes costing FIJI 145 million in losses.
Wow, that's a lot.
And yes, and it's just becoming, I'm more aware of this because I'm working in the forefront of taking care of this the people that have diabetes or other illnesses in level. So I suggested to Mrs. Taukave that it would be good to assist the government in empowering, educating people on how we can take this positive, intentional step to take responsibility.
Yeah, no, this is wonderful. Okay, we'll get her to come back again. Nimbula, nakabali mo na.
No, I'm here. I'm
Yep.
here. Just
Yep.
take it
Carry
over.
on.
Yeah. So yes, that's why we're bringing Barbara in for at this time.
Yes.
We just want to help the people of Fiji.
So it'll be
because
using following that order, Nandi Subalambasa on the screen.
That's correct.
Okay.
Yes.
Oh, that's great. And it's open to families, or how would people be able to attend this event, Sinate?
So there is a link that we send out to everyone. They can actually call my number 238-1917. 238-1917 for those that are in Fiji. And I can send them a link, or I can process their tickets manually. They can send me M-Pesa. The ticket cost $28.
Okay.
Yeah, and that's pretty cheap.
That's reasonable. Yeah.
The valuable information that she will be sharing.
Okay.
238-1917.
And then M-Pesa to that number too, yeah?
M-Pesa to that number. I find that most people prefer to do to call me and M-Pesa that number as opposed to going online to Ticketmax.
Right.
So if they can call me, I can direct them. If they're comfortable with Ticketmax, I can send them a link and they can go online and pay for their tickets online through Ticketmax. Alternatively, we do understand, and to make it easier, I can process their tickets manually.
Okay. So it's $28 per person, right?
Per session?
Per session.
Yeah, per person, per session. Yeah.
Okay. Per person, per session. Okay. And 28 FJD, yeah?
Yes. In Lombasa, there's 2 sessions. So
Okay.
as well as Suva, you've got one session on the 9th and one session on the 10th. Now Lambasa has it within one day, but two sessions in the day. So one in Lambasa, it's from 10 to 1 p.m.
Okay.
And then in the evening session from 6 to 9 p.m.
And that's on the 11th?
on the 11th of December. Yes,
Okay. The
at
11th of
Ramada.
December. Ramada. So what's the morning session? 10 to
1 p.m.
10 to 1 p.m. Okay. So Lambasa is two
Yeah.
session, and in Nandi on the 9th,
On the 9th, just one session,
just
that
one
evening
session.
session on the 8th, which is
Okay, so
6 to
evening
9 p.m.
6 to 9 p.m. And then Suva?
6 to 9 p.m. at the Civics Upper Auditorium on the
Okay.
9th and also on the 10th.
Okay. So 9th and the 10th in Suva, eh? So one
Yeah,
session in Nandi, two sessions in Suva, and two sessions in Lambasa.
that's correct.
Okay, Lambasa. Wow, there you go, ladies and gentlemen. Um, this was also the main reason why we wanted to come online and share this very important event. It's open to everyone, yeah, anyone that is listening. If you want to know more a little bit about, more about this event with Barbara O'Neill coming in as the guest. Many of us see her online. We watch all her videos. Now she'll be here in person. Yeah, she'll be in person. So, Asinate, what would be one word of advice or encouragement to our listeners to come along and be part of these events to listen to Barbara on these 3 days?
I'm all for, come with an open mind.
Mm,
Come with an open mind. The we are in a position where we are just we're reacting all the time to when the diseases are
mm,
at its final stages. We
yes.
don't have palliative care in Fiji. Often we see people at their worst, and we only wish that we're able to take care and assist people when they're fit enough to address the conditions
Mm,
they're at, they find themselves in. So I just want people to know that, look, this, come with an open mind. um Open yourself up to listen, to learn, and just absorb everything that's said, because this is for our own good and for the good of our families, for us that are parents. It's time to break that cycle
mm,
of people dying prematurely,
yes.
and we just, yeah, and that's just what be like the Bereans, like it says in the Bible, come with the readiness of mind and
Mm,
go back and search to see if it is so.
yes. Absolutely, absolutely. And I think you really hit the nail on the head on that one, the importance of being proactive, right? As you rightly said, Asinati, we've been always very reactive. Yeah. But for our health, we need to be proactive. Sevada, Asinati?
Yes, yes, very true.
Mm. Yeah, so we tend to kind of go to the doctor when something is wrong, yeah? Baka daw ko nitiko, alam na ngo nandan daw ko na valinimbula, eh? Hospital is na valinimbula. Tala ko mendala imbula, eh? Kaya baka da sa kanindang garo na nanandang bulang, sa nawawasar to kami na valinimati. If we're not careful, if we're not being vigilant, with our health.
Yeah.
So yeah, na viva ka lang kang gataki bikim ni na wekando ni barong tikumai na maramong ko Barbara O'Neill na ala butu ki biti tikumai na tikni sila sa bolito ngor na tiku biti ne kawalu ke ne katin kandua iya ne kalion sila sa tiku bakay tayo ko may nandi and nando na
So
na session na ono kina view dio na
it's
kaloko and amboni that's on the 9th sinate
8th in Nandi,
8.
Kawalu, Nandi,
Yeah.
6 to 9 p.m.
Right. Okay.
9 and 10 in Suva.
Right. 9, 10 in Suva, and then 11th in Lambasa.
Yeah.
Okay. Yeah, totoo kasaranga wavi vinakana nomu viva kungeti vikenda na kana bimbi talaga no mutuko na meya to be balanced tiko na way baka viti but this was something I always discuss on my platform Masinate ni da reda na way baka viti it's more kind of preventative ando baka samtaka nunguna sembera ni mivadi nunguna kondo soliwai o kondo tukuno ko ve irna la kuma mer mengunu bana wai babiti ni ku se mbulo mbulo bina katiko se selele na mati mengunu bara na wai babiti ya sega ni ko sa mbada lebu tu sa ngai ke come na wai babiti sa ambera it's too late andora kando buli da bali maybe ko no no tukuno ko sember ni la kuma na mati lebu ngunu bara da ba wili kinango sinate na dangolaya
Mm-hmm.
Nakangala to se kalilai nanito way to nga bi mataka na navangolai that was a norm ivale ni to se ngoni ngon ta keng kasi ta mikin na kay soli weekend na way babit it's normal sa siya ganin da kaila tiko sa da tangi sa soli nga menaway da gunuba kung kina wabi ni kung kina rubital ni kuwa kono mutu kono maya na bimbi ni balance menta re roro na sana pataru the medical side of things la ko balimbula but kina no mure de taringa the holistic and the natural way of looking after our health sebab sinat
Yes, yes. And the most important thing is touching on the balance is being able to use wisely the information. Because if you just put stuff in your body,
mm,
you've got to know how the condition of the machine first.
mm,
You've got to know before you can attend to it and customize your treatment to the condition of the body.
mm-hmm.
And our doctors have those machines
Yes,
to be able to look within. If not, we're taking a stab in the dark. And this is why that's important. We go there. It's all about decision making. We go there, hear from their point of view. See, ideally, we want to tread cautiously on making sure that we use things that are holistic, because other treatments have side effects. So if you can, so this is what it's all about: understanding what's going on here, what's best for me. And so it's our God-given right to make those choices, but we need to facilitate and provide that information so that the person is balanced enough to be able to discern or analyze the different informations from different places and then apply it to what's best, make a decision to what's best for themselves.
Sara. Vinak vale tengo sarva bulu chukumengo na marama bulu vinaka e vivi então bulu vinaka mai valangi pasimada salambongi she made a very interesting comment here tukunomoka definitely no grog for the men that's a very controversial topic but it's an interesting one maybe that's another topic for another day simada vasinate.
Yeah, just very quickly, all we're trying to do is build up our organs, right? We're trying to support organs, because as you take narcotics or ingona, cover, alcohol, they actually require more water to flush it out. Do you know what? And so you actually end up damaging either your liver or kidney in the long run. So whatever you put in your mouth, whatever it is, remember, is it going to give me life or death? And that's like one of the ladies had mentioned, Ellen G. White. She says, each day you're committing suicide.
Wow.
Your choices. your choices, the choices that you're making. You have to be very intentional in what you're doing and prayerful so that you are discerning the things that your actions, your words, and all that, because your body responds to it.
Totoo ka saranga. Wow. Yes, so I'm just going through some of the comments here. Nakawale merse ni langi-langi tiko may malaya. She mentioned here that cancer is a lifestyle disease. Healthy lifestyle prevents and cure these diseases. So it really comes back to some of the key points you were highlighting earlier, Sinate, on the lifestyle. And thank you for using Mr. Daugunu as a wonderful case study for all of us and so encouraging. Yeah, so encouraging from 120 kg to 80. Is that the correct number, Sinat?
85, yeah, 85.
85. Wow. That's really, really encouraging. And he did this for 6 months?
It was for 6 months, and they were it was a pretty disciplined time. So
Wow.
yeah, it really depends on people's bodies, but he did really well at that time. Yeah.
Wow. That is very
But there's
encouraging. Yep.
just one thing to note. Because it's a lifestyle disease, if you could drop it all, but you go back to the same way of eating, you get it all back.
Wow.
So if it's a lifestyle disease, you will continue to have that disease. If some people have this, okay, that's okay, I'll go detox, I'll cleanse, and then after that I go back. Every time you do that yo-yo, you are breaking down your organs.
And then.
And that's what we have to be cautious about. You have to be very intentional. If you want this disease, you don't want this disease, you've got to stay away from what's bringing it on board. And that means you can't go back and forth. Well, you can, but you're not going to completely eradicate the disease.
Wow, Asinate, for sharing all this information. There's so much appreciation shared here from around the world. And again, thank you for sharing about this wonderful event. Ladies and gentlemen listening, Barbara O'Neill will be in Fiji from the 8th to the 11th. And those are the dates that Asinate shared with us. The 8th, there will be an evening session in Nandi, 6 to 9 p.m. 9th and 10th of December will be in Suva. Sessions 6 to 9 p.m. And then on the 11th in Lambasa, 1 in the morning, 10 a.m. to 1 p.m. and 1 in the evening, 6 to 9 p.m. And for those of you asking for the phone number, I've shared it here on this page, but I will definitely reshare it on my Dr. T page so that you can be able to have Asinate's number. So for those of you listening, you can write it down now. 238-1917. 238-1917. That's a good way to remember the number. And that's also the number for any M-Pesa that if you need any help to pay for your $28 ticket for one of these events, please contact Asinate on that number. So Asinate, before we finish, I'll pass it back to you now for any last word of advice or encouragement to our listeners. Vinaka.
Okay, so the main thing I'd like to share before I finish is that I've experienced loss and I've lost my loved ones, and it had to take my mom and my sister to die for me to wake up. I wish that everyone, we don't need to go to that extent. And I wish that we would be more proactive. And I believe that I believe that with God in our lives, He's going to show us, because we're here for a purpose. And we all know we're here to glorify God. And this can happen through the way it should happen through the way we conduct ourselves in terms of our health and maintaining this temple that belongs to God. And ultimately, that is the essence of all this. It's good to, as I always say, it's okay. It's good to live longer, but I always ask people, why do you want to live longer? For what purpose? And I think it's really important to be centered on God, because when we live longer and we do the Lord's will, that is the purpose we are here for, put here on earth. And I think that's what I'd like to leave with you all today, that we are here for a bigger purpose. And by taking care of our bodies in the temple of God, we're able to discern the Lord. We're able to be better examples, because when people look at us and say, oh, their God is so powerful because they are not sick. That's one way of glorifying God with your bodies. And He has given us everything. The Bible, the Word of God, is our health book. It's our medical book. And so as we become more, when we increase in knowledge from the Word of God, God will enlighten us in terms of how to treat our body. Thank you very much.
Sinate for being with us today. Nabukui kimamina varong chukani kua, Vitoranga nangonongo mo babi ni binaka bikim roba viutini, bikimi wat ke Mr. Daugunu, and nanamundrau vengaraviti kumenreketi. Madhuata me vano levu, lele vera babi ni binaka tikumai namundro vengarav mikeri, etiko namundro social media page, bikim don namundo non-profit na Shalom Wellness.
I had it up and running, but I've just taken it down just to do a bit of work on it.
Okay.
Because we do sell some products from overseas, like cayenne pepper,
right.
Charcoal, activated charcoal. So there are some. We also try and get good quality products and having it accessible to our people at an affordable price.
Okay.
So at this time, I've just taken it down. I've got to do a bit of work before I put it back up.
Okay, so if people want to get hold of you, they just contact you on your phone number?
Yes, just call me on my phone number. But it should be up and running soon.
Okay, all right. Yes, binakabalim sa Sinate for joining me today. Vanu ni binakabikim draw baka biutini na nomdro vengarabiti ko baka lotu may vanu levo vanu ni binakatalangan la songo no nalak maingo babra na no ngalichuk may vaitabi viti na levo sa na matataro sa nambiudak chika na numunang bari telefoni meron nang gay bitartareno ira na lini vanua. Binakabalim Sara.
I'd just like to take this time to thank you, Dr. T, for the amazing work that you're doing and allowing us to come and use your platform to be able to share with our people. And we wish you all the best in the plans you have ahead and in your farm and the plans you have for your farm and also in the way you're contributing to our community. We're very blessed to have your influence and your help through your platform.
Much appreciated, and I'm glad that you're here to be able to share this timely information. We're coming to the end of 2025, and I think when people are planning for the new year coming up in 2026, this is such a good time for them to just kind of change our mindset, and put in some discipline. I'm just thinking, if Mr. Daugunu can have his life change in 6 months, imagine the influence that his story is going to, be passed on to so many of our listeners who are watching tonight. The importance of looking after our lives. And you are very true, when you said that, a lot of premature deaths, so many young people, dying, not even reaching 50, very young age, and many of them leaving behind very young families, just because they are not looking after their health. So thank you for enlightening us. Thank you for reminding us about the important gift of life, that we have, and our duty is to look after this gift. Pinakamakaliw salo. Alam mo yan, vale wikim raw may nriketi may madwata, doon singa, gay nita kitu nito ng galisota yan, nambabatu. Dagalisilian ni namdo diway tutoka, may banoliw. Pinakabaliw sara. Lolam sara vale wikim raw.
Naka
Iya.
da.
Naka, mana banda,
Ne.
naka. Isa, babili binaka makalebo be asinate tiko tanda umunu siya masarti ko ko may nriketi may madwata non ro ben karapti ko baka biotini bat ke Mr. Seven ada daw mun ro baka biotini ro ben karapti ko na non ro to tambana ni ben karapi baka lotu may raketi matwata totoka na non na may waseti ko na non na vivukitiko non rakauti ko na vivekani kibal nimbula ndora kay wasetal tingo ko ndora ulutanga binakaya ni lele werarere lando lako ibalimbula viketo madangai nanungu mata bubale keto red saranga lebu na wikiketo era rere na lako ibalimbula o andoni talangana nito chukumeni silandi na nito ni na nonong wala meni silandi do rere bakali bukan na lako ibalimbula kero sa do salvat itu belete meni silandi etiko na fanau support fanau na wasba maori na family. So there's family support. So you can go with your family member to the hospital and you can sit with them inside the doctor's office. Even though there's an issue of privacy, but because you are there to help them, they're just making sure that confidentiality is held to a high regard, that all the information about them is not shared, without consent. And so, yeah, it's a big wake-up call for many of us to make sure to at least have annual medical checkup. Yeah, check tek tumatanganon tan ra. Lako tumatangali check tek tu nanonta uto. Se mumpulong-pulong pinakatu. Nalam niya pakiko vital tanga wala kalak seber ni utsina ta vitalan no. Ang girsarbe nito bunuay ke berarti kito wakay suhe so mucho na nanong kutambanan ni university na nito lure bak bunuay medical insurance o kasarbe to na bitamane tolak to luray mate sar ni tar torong mayo nito tao lobo kanto simptomatic sa do manangar ka labisaw ni nonda mindset kinabakan tao mindset. We have to change that. Kung kayo sinat, we have to change the mindset. So you don't have to be sick to go to the hospital. Rodi ang pulang-pulang pinakatu. Labasi ko matangayan, di ba kung pulang pinasi, to kung virto, tutor mo na mundra. Tutor mo na kaya gumbimbi. Si tutor mo na madalin nung uto. Nakaya katong ka. Sa gomisa biyang paki, may katusan ka doon ako tiko. So ambek mengo sana ke lurai nanomunra go lurai kina no musuka bango na kena ko no kolesterol go kakir keda no mutumrinra sa lutu sombungo sa binakango da babi ni binakakina ni solbi keda na ngala menda ngole ni balimpula. So that's something vivo con kita nga weekend ang tutukun chukayo go na dalang ko na vale ni bula da kunirere na uira na buni way bat kena nasi era laki buli na kena korni buli merang ben karabek na buku kena kila kai solvire suli ngabir na kalo non resuli soli merang ben karabe na buku me na bulan bulan benak ko ngayo vi ba kong git kini bikem ni ta karororo bakalew vi keto me na mo sila na chuka na so vi keto me kandaw talanga na ibuso virto me wani buka klan na to virto na limbo to may tabi uni nagana bikim do na wavi hindi na bunuan hindi na dana do na kakalbi na karororo kakantal nga ni Vilomani au sana yali ke bat sambala mo gumagat yato au lita ka ni rongo binaka ni na bio liba liba main reketi Maduata che vecchia munira vacante e vese provura che ne vese bitu ni vakarong tik mengo sa ko modani vecchia muni e na lo mani vida na sing sa go and then bako bulan itu ko kina vida na bulan ni Australia vida na bulan telanga mai biti ke na so telanga na to bulan ni Amerika anta to malat nga na ta betala no sa ko modani vecchia muni na ko vale usar no muni se mati ko mai ne wanga vakatonga malo ne wana se mati ko me okalandi asena Balekandavu, Meme Tuibuna, um, yes, Dia Vas, Lysenia Leuta, kay Alice Buki Buki. Nakabaliw sa rawa ko kumay. O sabi ko mo dahil ni Vicky mo ni Mata. Naka.